So welcome back, guys. So today we will going to discuss about antibiotic susceptibility testing procedure. So we have talked about various antibiotics earlier and their mode of action, and we have also started our discussion on drug resistance. So today we will going to discuss about two tests that will help you to understand which antibiotics are sensitive to a particular microorganism. So if you have watched my Staphylococcus aureus last two videos, then I think you know that I have told you that as Staphylococcus aureus have the ability to adapt very quickly, we are using handful of antibiotic and we are testing to find out which antibiotic works against them very well. Okay, so this kind of test that I will today going to discuss with you are kind of those tests, okay, that shows us which antibiotics are susceptible to our microorganisms. Okay, so here I am going to talk about two things. One is minimum inhibitory concentration. Okay, so remember it that minimum inhibitory concentration is especially important for bacteriostatic antibiotics. Okay, because I think you can understand when I will going to told you this definition of the MIC, that is minimum inhibitory concentration is the minimal concentration of the antibiotic that result in inhibition of the visible growth. Okay, that means here we are not talking about death of the organism, we are talking about the inhibition of the growth, means inhibition of the metabolism, right? And I have told you bacteriostatic antibiotics slows down the metabolism, right? So whenever we are talking about MIC, mind it very carefully that we may talk about bacteriostatic antibiotics. Okay, so similarly, the another important technique that today we will going to discuss is MBC. MBC is minimum bactericidal concentration. So as its name suggests, it is the minimal concentration of antibiotic that is enough to kill 99.9% of the original inoculum in a given condition. Okay, so these two things are kind of LD50 and ID50 we have discussed, right? That in the very first videos of medical microbiology we have discussed two terms, that lethal dose 50 and infected dose 50, right? So infected dose 50 means, or infectious dose 50 means, infectious dose 50 is the minimal amount of pathogen that is enough to infect half of the population, right? And you can find similarity of ID50 with MIC. MIC is minimum inhibitory concentration of the antibiotic that result in visible inhibition of the growth, right? Similarly, MBC is quite similar with our LD50. LD50 means the number of microorganisms that will kill half of the population, right? So similarly, MBCs talk about the concentration, the minimal concentration of the antibiotic, okay, that will kill 99.9% of the original inoculum in a given condition. Okay, so now we will going to discuss about how MIC and MBC we are performing, and I am also going to show a experiment result that I have performed in my college along with my friends. So first of all, the MIC is measured in a experiment called Kirby-Bauer test or disc diffusion test. Okay, although it is a separate practical itself, that is the disc diffusion test, and MIC is itself a separate practical. That means I just want to told you that MIC cannot be only determined with the help of this disc diffusion test. Okay, you can also determine MIC with the help of liquid media, that we will going to discuss when we will start to upload the videos especially for practical exam. Okay, So today we will going to discuss how we can determine MIC with the help of disk diffusion test, but there are another important procedure that we will going to discuss in those videos. Okay, so here I have written a kind of introduction. So let's try to understand the procedure. So the procedure is, there will be a petri plate containing appropriate nutrient medium, okay, and we will inoculate our bacteria of interest. Okay, now we will add a filter disc which is impregnated with a appropriate concentration of antibiotic. Okay, again we are going to use a filter disc which is impregnated with a appropriate concentration of or standard concentration of antibiotic. Okay, let me show you how those discs look like. So as you can see here, we are using tetracycline. So this is the discs that we will going to use. This is for ampicillin, okay, and this C is for cephalosporin. Okay, similarly here we have used tetracycline, we have used, so although here we have not obtained any colony, we have not obtained any zone of inhibition. What is zone of inhibition I will going to discuss. So that is the kind of disc, okay, and the opposite side of that disc is containing a concentration, appropriate concentration or standard concentration of antibiotic. Okay, that is mentioned by this stain, as you can see. I think you can visualize it. Okay, so we are using those appropriate those standard concentration of antibiotic containing disc, and we will simply place them onto the surface of the agar plate. Okay, now we will allow them for incubation. Okay, so as a incubation we will get a bacterial lawn, right, as here we have obtained. Okay, and especially around the disc we will get zone of inhibition. Why we will getting zone of inhibition and what is zone of inhibition, let's discuss. So as I have told you, here the disc is impregnated with antibiotic, so we will place those discs in such a way that the antibiotic can diffuse, okay, in the adjacent surfaces. And remember it, this diffusion is depending on the three things. Okay, one is the diffusion rate of the antibiotic itself, another one is the growth rate of the microorganism that we are using here, and the third one is the susceptibility of the or the degree of sensitivity of the microorganism. Okay, so this diffusion is depending on the three factors I have told you. There one is the degree of the sensitivity of the microorganism, and the growth rate of the microorganism, and the degree of diffusion, okay, or the diffusion rate of the antibiotic. Okay, again I am repeating, it is the diffusion of the antibiotic is depending on the three factor. One is the diffusion rate of the antibiotic, the second one is the degree of the sensitivity of the antibiotic to the microorganism, okay, or the degree of the sensitivity of the microorganism, and the growth rate of the microorganism. Okay, depending on these three important factors you will get different zone of inhibition. Okay, I mean the different zone of inhibition or zone of inhibition which differs in their diameter. Okay, as you can see here, the zone of inhibition of tetracycline differs from this one, right? Similarly here it will differ. Okay, so this is depending on the three factors I have told you. And now let's try to understand the zone of inhibition that we have obtained here again I am repeating, the zone of inhibition that we have obtained here, if becomes equal, or if the zone of inhibition we have obtained becomes greater than the standard one, because remember it, there should be a standard value. Okay, so if your zone of inhibition becomes higher than the standard value or equals to it, then make sure that your microorganism is susceptible to that particular antibiotic. Okay, again I am repeating it, that let's say the zone of inhibition we have obtained here for the tetracycline is greater than the zone of inhibition for the standard of the standard. Okay, so under such circumstances we can conclude that here our bacteria is susceptible to the tetracycline antibiotic. Okay, similarly, if the zone of inhibition becomes smaller than the standard one, then we can conclude that bacteria have developed some kind of resistance towards tetracycline. Okay, so that is how the disc diffusion test is going on. Okay, and remember it, the zone of inhibition in the disc diffusion test is inversely related to, so most importantly, the zone of inhibition we have get in the disc diffusion test is inversely related to MIC. Okay, and how this MIC concentration will be determined, we will going to discuss in our practical lecture video, where we will going to construct our lecture video on the basis of the practical viva exams. Okay, so that is the concept for MIC. So here I have written what I have mentioned you via image. So if you want to use this for your note making purpose, so you can take a screenshot of this. So now it is time for MBC. So what I have told you, that minimum bactericidal concentration is the minimum concentration of antibiotic that kills 99.9% of the original inoculum of the population, right? So here what we will do, so here remember it, there will be a series of test tube. Okay, and each of the test tube there will be liquid medium in which we have inoculated the microorganism. That means microorganisms are growing on the liquid media, liquid culture media. Okay, and we will add different concentration of a particular antibiotic. Okay, suppose in the number 1 test tube we have added the lowest concentration of ampicillin, then we have added a slightly increased concentration of the ampicillin in test tube 2, and in the 3 we have increased the concentration of ampicillin, and in 4 the concentration of the ampicillin is greater than the 3. Okay, now the lowest concentration of the antibiotic which kills the microorganism present in the tube should be considered as a MBC. Okay, so let's say the tube is 2, the 2 level test tube are considered as MBC. Then the concentration that we have added in case of test tube 2 will be considered as the minimum bactericidal concentration. Okay, so that is what I have written here, that in the broad dilution test the microorganism is grown in liquid medium containing different concentration of the chemotherapeutic agent. Okay, now the lowest concentration of the chemotherapeutic agent that kills bacteria is called the minimum bactericidal concentration. So in short, we are using MIC and MBC for the antibiotic susceptibility testing. Okay, that means which antibiotic are susceptible to which microorganisms, and this kind of techniques is specially developed to know which microorganism have bacterial resistance, and as a result what kind of antibiotic we should choose to destroy them. Okay, so the first one is MIC. In MIC what we are doing, in MIC we can perform the disc diffusion test. Okay, or we can, which is also known as your Kirby-Bauer test. Okay, so Kirby-Bauer test or disc diffusion test can be done where we are inoculating bacterial isolate at different or throughout the plate. Okay, and then we are placing a specially disc which are impregnated with a standard concentration of antibiotic. Okay, then upon incubation we are getting zone of inhibition. Okay, and then by comparing those zone of inhibition with standard one, we can conclude whether the microorganism is susceptible to that particular antibiotic or not. Okay, so that is the MIC in gist, and MBC is here we are have series of test tube. That series of test tube contains various concentrations of the series of test tubes contains liquid culture media, and we are adding bacteria. Okay, so bacteria will grow here, but we will also add different concentration of an antibiotic. Okay, and now the lowest concentration of the antibiotic that have the ability to kill bacteria is called the minimum bactericidal concentration. Okay, so that is the MBC. So that's it for today, friends. So I hope this video will be helpful to you. So thank you for listening to this class.